Hi guys, have you been thinking of coming off the birth control and thinking if there is something special you need to do to make the transition much smoother? Stop thinking. You do not need to do anything special. Remember, just because you were on birth control, your body did not deplete of any nutritions. There was nothing else happening, but all the birth control did was to stop you from ovulating, so you did not get pregnant. Now, you must have heard from a lot of sources that you need to do something special. You need to start taking these supplements. You need to use these cleanses so that this transition is smoother. That's a lie. It's a complete and total lie, okay? It's a marketing strategy by people and these companies who are trying to sell you things. That's all about it. So if you want to stop taking your birth control, then what you need to do, you need to have a plan, number one, and number two, some realistic expectations of what to expect, okay? So let's think about what can happen after you stop taking the birth control. So once you stop taking the hormones, it will take 2 to 4 months for your menstrual cycle and ovulation to come back, especially if you were on a combined hormones. If you were on a depo-provera, this takes a little longer. It could be 6 to 8 months before your cycles as well as ovulation comes back. But ovulation comes back, okay? It may take a little longer. It does come back no matter how long you have been on it. It does not matter whether you are on it for a few months or you were for a few years. The ovulation will be back and you don't need anything special. Now, what to expect is very important. Maybe you went on the birth control because you had acne or oily skin, and after stopping the birth control few months later, because the hormones are out of your system, you may notice that the acne or oily skin is coming back. That's not because of birth control. That was the reason you went on birth control. Remember that. Same way, if you went on a birth control just because your menstrual cycles were heavy, or you were having cramping, or you are having a PMS-like symptoms, or you have endometriosis, you have PCOS, all those conditions can come back few months later after you stop the birth control. So while you were on the birth control, you have forgotten all those symptoms, but now when they come back, don't blame the birth control for it. It is what is the underlying condition coming back. Now, you are in perimenopause, and after stopping the birth control, you start experiencing hot flashes or night sweats or vaginal dryness. It's because of the perimenopause. When you were on those birth control, it was helping you with those symptoms, and that's why you did not notice it. So these are the few things. These is what you're going to be expecting after stopping it. It's not the birth control. These are the underlying conditions. So if you want to stop it, but have a plan. What should be your plan, right? If you stop it but you still do not want to get pregnant, then you have to have some plan for prevention of pregnancy. If you were on birth control because you had the underlying conditions like what I said, like endometriosis, PCOS, or heavy menstrual cycle, then you need to talk to your doctor and find out what else can be done apart from birth control to treat those conditions. And lastly but not least, if you are in perimenopause and you start experiencing those symptoms, then you need to talk to your doctor and get a treatment plan going. So what's the take-home message? If you want to stop the birth control, you can just stop it.